All right, Dr. Johnson, it
All
says we
right.
are live on
Okay.
Facebook.
Good afternoon, Crook County School District. Today, we come to you with a heightened level of concern about the COVID activity in the community. And also, we come to you with the message that in the schools, as we wear our masks and socially distance and clean and I think mostly it's that mask wearing that it is not entering our schools, yet it is surging in the community. So today we want to talk to you about how things look and what we can do to support kids in this community. And I hesitate to use the words kids, but it's our young people in this community, the children all the way from kindergarten up through 12th grade. And there's things that we as adults can do to lower the activity and to keep students in school. Today we have some information for you about how the district is doing, and we have some question and answer to provide, and of course, Dr. Hoff has a chart.
Brought you all a chart.
One of the great privileges we have today is we have our health department on. Katie, I can't remember exactly what your title is. I know it's like the
Deputy Director.
Deputy Director. Okay, and so they have, Katie has graciously agreed to come on today and help spread the message of how we can impact COVID in our community. And, it's my greatest that we can protect our students. And it's, I listen to students and the things they say about wanting the life that most of us have enjoyed at school, that opportunity to interact with others, to eat lunch together, to walk the hallways together, to joke and to talk to each other and to play athletics and to sing in a choir and, play an instrument. Those are the things that COVID is forcing our kids to give up if we don't have them in school. Our teachers have carried such a heavy load. Our administrators carried a heavy load. Every staff member in Crook County, the bus drivers, the people who prepare the food, the people who clean our buildings and repair our buildings, those people are carrying a heavy load so that our children can be in school. And we're asking our community to do what you can. And if you wear those masks, we have seen it in schools, and we know that the science backs it up, that we can keep COVID under control. It's, I wouldn't say it's exactly under control right now. And I think it's a good time, Dr. Hoff, to pass it to you before I get too emotional.
I'm not a very emotional guy, so yeah, I'll take it from here. So what I'm going to talk a little bit about this afternoon is I'll show you where we're at with our metrics. And we have, Crook County School District has had the luxury of, because we were in before the state changed the metric rules about a month and a half ago, because we were already in, they granted us safe harbor, which meant that regardless of where the metrics are at, they didn't want to have a yo-yo as they changed systems. So they said, for those districts that were already in, and we were very lucky to get in early, they said, you can stay open regardless of the metrics. We'll give you safe harbor clause until January 4th. And as our cases have continued to increase, and as we get closer to January 4th, there's some very real implications on what that means for our schools. So that's what I'll talk about now as I share my screen here. Let's see. All right, so Dr. Johnson, give me a thumbs up. Can you see that?
I can see that. Thank you.
All right.
It's good.
So every Monday, the state releases our bi-weekly case total. So they take the cases from the past 2 weeks, add them together, and they tell us what our bi-weekly total is. And they also take the test positivity rates for those 2 weeks. So you can see down here, let me get my laser pen on.
Oh, good.
Look at that. Anna Logan taught me that trick. So you have over here the 2-week date range, and then it has this number is our biweekly case total. This number is the case ratio per 100,000. This one doesn't matter for us because we're a small county under, I think 30,000. And then this number is your county test positivity rate for the 2 weeks. So the most recent data, we had 63 cases were over the past 2 weeks, and our test positivity rate was 6.5. And then you take those numbers and they have this little matrix up here. So our county test positivity rate at 6.5, that's actually stays right here in this yellow zone, which is the exact models we have right now, which is K-5 in person every day, and then we have a hybrid 6-12 model. The kind of tricky thing that I'll talk about is our case count, 63 cases. That puts us in this distance learning box. So if we did not have Safe Harbor right now, that designation from the Oregon Department of Ed, then we would have to be shifting our schools K through 12. There's no longer a K-3 exemption. So if we did not have Safe Harbor right now, we would have to be shifting our schools back into full comprehensive distance learning. But let me explain this safe harbor, because this question comes up. Shouldn't we be closed right now with these metrics? And what is this safe harbor thing I keep hearing about? If you're really interested in this, the Oregon Department of Ed in their Ready Schools Safe Learner Guidance gives you a lot of the details on page 16. But to say in kind of general terms, as long as we're collaborating with our health department and our schools continue to be safe, where we're not seeing untraceable spread, we actually haven't seen any actual transmissions in our schools at this point, we can stay open through January 4th. But that should bring you to 3 very important questions.
So let me talk just a little bit more while you're flipping forward about what Safe Harbor is.
Yep.
I wanted to address the word of collaborating. What does that mean? It doesn't mean that we just put our heads together and decide what to do. What it means is we put our information together. We figure out the risk. We figure out the risk to our students. We figure out the risk to our teachers. We figure out the risk to our staff, which includes buses and food service and every prong of the district. And we figure out how safe it is. And then we take that advice in collaborating and sharing that information, and we make a decision about that day and that week. And so once we get to January 4th, we no longer have that local option to say, how is this impacting schools? At that point, we have moved through this space of Safe Harbor, and we move into the standard matrix and standard expectations that all other schools across the state are abiding by at this point.
Very much so. So our 3 big questions. So you might ask, all right, well, cases are continue to increase. So while we still have Safe Harbor for the next 2 weeks until Christmas break, what would it take to close schools and shift to comprehensive distance learning before then? So that would be based on the COVID spread in school. If we ever believe it's not safe for students in schools because of COVID, we would close them. As well as if the health department, or if Katie Plum comes and says, hey guys, it's just not safe, you got to close them, that would be definitely what we would do. Another question you should be thinking about, after Safe Harbor expires on January 4th, what would it take to close schools? And that talks to what Dr. Johnson was just saying, where once beginning January 4th, we no longer have Safe Harbor. So if our cases are greater than 60 in the county for the biweekly total, or if our test positivity rate is greater than 10%, that would cause us to shift back to comprehensive distance learning. Third big question has to do with the future. So Safe Harbor expires the first day after winter break. When will families know whether we are in comprehensive distance learning or in person for January 4th? Here's where we've got, this is the school calendar for the next 2 months. So Safe Harbor, as you've heard, ends on January 4th, right when we come back from winter break. The data, we get data updates every Monday. So if cases start to decline, if we see Crook County, people change their behaviors, they're really starting to get after all these safety precautions and our cases go low, we would get updated data the Monday before. So what our plan is the data usually comes out every Monday, kind of later in the day. So we'll get that data on December 28th. And if it's low, if we're below the thresholds, then we can say, hey, we're coming back strong. We're continuing in-person learning. If it comes back high on the 28th, then on the 29th, this is when we'll send out our whole communication and do a staff fireside chat. If I know Dr. Johnson, we're probably going to do a community fireside chat as well. But we'll come out and we'll let parents know, hey, next week on January 4th, we're either in person or in comprehensive distance learning. And as you can imagine, and what Dr. Johnson will talk about, our teachers are already beginning to plan for either situation. Because as we know, if we can keep our schools open for our families, we want to do that. However, if the metrics, without our safe harbor clause, if the metrics don't allow us to do that, then we want to be ready to go to serve families and not miss a beat on January 4th.
And I will say that's what our teachers did today. While your children were out of school, our teachers prepared to be able to move seamlessly to comprehensive distance learning. I think it would be a good time for us to welcome Katie Plum onto the Zoom screen and to ask Katie if she could tell us what you're seeing in the community, and is there still a hope that if people were to adhere to the guidelines of wearing a mask, that we could lower it before we would cross out of safe harbor?
Sure. Hi, everyone. So what we're seeing this week, and really for the past couple of weeks, is certainly an increase in cases in the community. So far this week, we are at 36 cases. And so coupled with the week previous, we anticipate that we will be above that 60 case threshold going into next week. So if the trends continue, we will be above that 60 case threshold that we're looking at that Joel just described. I think what the community can take to heart is what Sarah described earlier, is that the preventative measures really are working, which is evident in the case investigations that we're doing here at the health department. We have not seen spread within our schools. So if a child or a staff member has become ill and for, some reason they weren't symptomatic or, they were mild and they did come through the school doors because everyone is using precautions, we haven't seen transmission. And for the most part, because our school nurses are doing such an amazing job, there's screening protocols in place. Families are understanding the importance of staying home when kids are sick, then all of those things are working within our school buildings. And that's really encouraging for us as a health department to see that those measures really do work. And I am 100% confident that if we can apply those same safety measures in the community, our case rates can certainly go down. What we see as far as trends in our current case rates are typically social gatherings, and that's when we're more comfortable around the people that we have, our friends and family. We're letting our guard down perhaps a little bit and not wearing face coverings or distancing. And that comfort level is what is showing up in clusters of cases. And The other place that we see maybe some higher numbers pop up in positive case counts are workplaces where there aren't masks being used or used consistently and correctly, right? Because it is possible to wear a mask, but if it's not worn properly or all the time, it doesn't do its job. We are seeing results of some get-togethers over the Thanksgiving holiday. So those cases are showing up as well. And that's really important to be mindful of, as we do have another holiday coming up where typically we would get together with family and friends. And it could mean, I really do think in order to get our case counts down, we're gonna have to make some tough decisions over the holiday potentially. Even if it's just the tough decision to wear a mask when you're inside and opening presents, right? If you do have folks outside of your household joining you. But those things really can and do reduce positive case counts. Is there anything else, Sarah and Joel, that you're curious about, or would you like me to take questions? I'm good.
Well, I think at this point, it's important for the people that are listening through this communication channel today to know that there's a high level of concern in the community leaders. I just received a call from Mayor Uffelman asking me, what can you do to get the message out? And we continue to share the message that even if this just doesn't match your paradigm, could you please, for the children, could you please wear the masks when you're in a gathering? You can drive around the community and see large gatherings of people, even outside, and they're not masked. And, when I go and see the students and I hear them say that they want their senior year to be like that other kids have experienced, or I walk through the elementary school and I see people, putting up gingerbread houses and, putting together, the Polar Express train, I just realize how much the kids will miss if they can't come to school. And I'm just advocating for the voices of the students to please, out in our community, please wear a mask, stay home if you can. And if you must gather, please wear that mask in the gathering, because it makes a difference to our children. It makes a difference for what they get to experience. And they will not get another chance to go through this year. This year will come and go, and they will just get what we empower them to receive. It's important.
I think I can assure all our viewers, as you can imagine, and as you've seen, we have, written the government waiver request. We have taken every step we possibly can to keep our schools open in a safe way. And it's great to see that we've had our schools open for 12 weeks, 1,800 students, 400 staff, and we've seen zero transmission at school. So we know it's safe, but we have scoured the rule book. We have extended our safe harbor as long as it can go. And we're just at this point where if we can't get our case count down, we can't, there's no other way we can find to keep our schools open. And we know it is so important. There's no longer, there used to be an exception for kindergarten and third grade where, okay, even if 4th through 12th graders are out, K through 3 stays in. The state has eliminated that exemption. So now if we have to go out January 4th, it is all kids outside of Paulina and Brothers, because they're under 75 students. So this is going to have a huge impact. And we are, like I said, we're continuing to try to figure out every way we can, but we've taken this thing as far as it can go, where if we can't get our case count down come December 28th, then we're going to have to make that call that we're going to have to shift to comprehensive distance learning, which we know that would crush so many kids and take away a lot of experiences. So we're trying
it has to be kept down low for a period of time. Once we go out, it's hard to get back in. So we have to go down into that super low zone and we have to stay in that zone for an extended period of time before we can even bring our kids back. So yeah, we're asking for your help, and we're asking for your advocacy. And we get it, it's a political, there's a political strand that goes through it, but regardless of any political statement, I really want our kids to be at school. And we're doing this on the backs of our teachers and our staff, and they're carrying the weight. And we're trying to keep everyone safe, but we need to get our community spread down.
With that, Dr. Johnson, I don't think we have any other talking points. I think we wanted to open it up. We haven't done a fireside chat in 2 weeks. We let our people down. I think it was over the Thanksgiving holiday, but we wanted to open it up for questions both on the Zoom as well as Facebook. So I see one question. I'm going to send it to you right now, Dr. Johnson. It says,
all right.
Please explore ways to get this out to the community at large so we can work. We have
I'm willing to do whatever people can suggest that we do. We try to take advantage of every communication channel we have. I think this is a point where our parents need to talk to parents who need to talk to community members. And then, we really need to, it has to be shared at the boots level. Jason Carr, who is just fabulous at getting communication out. We're doing a press release. We have a campaign that's our school board to encourage people to adhere to the safety protocols. And if you have people that I could call or I could contact, I'll do anything to make sure our children get a school experience. So I'm willing if people have suggestions.
Kathy is suggesting we put it on the reader board. We will certainly do that.
Got it.
Like we said before.
Just a message to say, wear your mask.
Yeah. Can we put on the reader board? Cindy Minow saying, can we put it on reader boards? Yeah, very much so. So that you'll see that around. Our director of communication, Jason Carr, he will get you any sort of logos or anything you need. We've got a stay safe, stay open logo that I know people have done.
Dr. Hoff, how about bringing your chart up? We have a question about what is that extended period? So the chart can show how low we have to go, and then we know we have to stay there until we can get a 2-week period that's within the
That's a good question. So you have to, I don't know if there's a 2-week, you have a 2-week window to act on your data. So if we are kicked back into this distance learning, this red zone, in order to get back into our current models, you have to get back to your yellow zone. So if we got over 60, once our safe harbor is over, so if after December 28th, our biweekly total is over 60, we then have to get back to our biweekly total being 45 or lower in order to make that transition back in.
And then it has to, okay, I think you said that though, we have to have 2 weeks.
I don't think you have to stay at that 45 for 2 weeks. Remember, it's a 2-week biweekly total.
So you could have like a 55 or you could have a 45 and then a lower number, and that would lower your number for 2 weeks, right?
And one thing we've been really cautious about is looking at the trends. One thing that every parent has told us is they do not want a yo-yo effect of 1 week we're open, 1 week we're closed. So we've really looked at trends. So we definitely want some solid lower numbers under 45 to be able to make that decision.
I think that we are far enough out from that January 4th deadline that this really could happen if this community joined together. And I think that's that's the message that we need to get out there. There is still a chance to bring it down before we would have to exclude our children from school.
Yeah, we're seeing a lot of comments on the Facebook just saying the schools are, I mean, it's hard to argue with empirical evidence of, hey, we're in Crook County. We've seen Crook County schools open for 12 weeks and we literally have not had a transmission from someone to someone else at school because there's all these safety precautions. So that's why we believe our schools are the safest place for kids to be. Not only, physical safety, but man, think of students' mental health, their academic abilities. If kids are back online, we know that that's harder to learn for some students. So with all that, we're saying we got to keep cases low so that we can keep our schools open because we know that's best for our students.
I think it's just such a remarkable thing that we have been in school 12 weeks and it has not been in the schools. People have gone out places and they have been exposed, and then we've excluded adults and children from school. But as far as people getting it at school, it is not happening.
Yeah. So no, it's definitely our plea that we can keep our cases low. So I'm just trying to. Ooh, good question.
So there's a question about the vaccine, and there's a lot of people, including us, advocating that educators are among those who have access to the vaccine. And I believe that once it is available to the general population, especially, I think there'll be educators who will get it. And maybe I should be letting Katie speak about this because I'm probably talking.
I know a little, she might have a little inside scoop on the vaccine.
I was just on a call earlier today that I've been on several around vaccines. The planning for around vaccine distribution is definitely ramped up. And I see the document I'm looking at right now shows in the first phase of vaccinations, there's kind of 3 groups within that phase, and educators are listed under essential workers, which is the second group within the first phase of distribution. That sounds awful theoretical and we haven't attached dates to it yet, but just know that our educators have definitely been prioritized in the distribution.
And I have the privilege of being on a committee with the governor, and so each time I'm on there, I'm advocating for educators, and I also am advocating for the federal government to expand the school year, to put in COVID relief money so that the school year could be extended. But none of those things are for sure. And the thing that we can do right now is control our own actions, and then we can get the spread under control before our kids are excluded.
All right, that was a good question, Tammy.
Joel raised our question, so.
I'm not seeing much else, but I know that I am much quicker with the wait time than you are, Dr. Johnson. So we'll give him still another few seconds. You always tell me to slow down.
All right, Dr. Hoff, Dr. Johnson, this is Jason. There's a question on the Steens Pillar Facebook page. A mom just saying, really wanting us to be more upfront about a game plan and when we're supposed to come back in. So you might want to explain that.
I will do that. Yes.
Sort of how we're going about that.
So it's very clear that when the data comes in on the 28th, December the 28th, we will know whether or not our district can stay open. If we cannot, we will do a fireside chat. We will work with Jason Carr, Director of Communications, and we will get information out that tells you that either we do have to go to comprehensive distance learning or we don't have to go to comprehensive distance learning. Teachers took today to be prepared. And now all of the responsibility shifts over to how the community responds to the activity of COVID in this region. On the 29th, I can tell you for sure whether or not we can be open on the 4th. We have a question that says, what is the state's rationale of shutting schools when they are safe? And, you know, that's one that, of course, is based upon the state's research and the state's guidance. I think they have been responsive to people wanting to have a local decision and local input. They changed the metrics, and locally we started school, and locally we have been able to stay in school. But now the activity rate of COVID in our own community is up so high that our health department is having to operate in their surge protocols. Our hospitals are having to work with the number of COVID patients that they're experiencing here. And once schools get to a certain level, they close them, and you really are shut down in your own homes to just stay isolated from other people. You know, it's more about teachers getting exposed and then not having staffing to deliver education. It's a very complicated web when a community gets sick. And so what we're looking at here is, how do you keep teachers healthy, and teachers have children too, and keep those kids going to school. The system all moves together. And once your community gets a big surge and a lot of people that are ill, it begins to impact how schools can operate within a community, because schools are not a separate, they are a part of a community. They're a subcomponent, as you well know. So,
Laura, and I can assure you that you know, Dr. Johnson and I can control the Crook County schools and what we're doing. And I can assure you, we're advocating. Dr. Johnson was on a call directly with the governor earlier this week. And she said, "Hey, we've kept our schools safe." So we're getting that message out, but we're not able to change state policy from our chairs. But we are advocating and making sure people know, hey, we've been in school and they're safe. Jeff Reynolds had a question about whether the positive tests were from, looks like a rapid testing procedure or a more extensive testing process.
This might be Katie's question.
That would be a great Katie Plum question.
It's a combination. I think there are multiple tests being used in the community. You know, some folks go to Redmond to be tested, or, you know, out of town, and each medical provider has a variety of tests available. So it's a combination of all of the above.
Thank you, Katie. I'm not seeing any more questions. You know, on Fridays, I usually like to end this thing and get out of here, especially when it's sunny out. But we'll give a few more, a little more time.
And we are here, you know, we are here every day wearing our masks and working. We're in separate offices now. We just don't even want to take the risk of spreading it among ourselves. When we're together, we're all wearing masks, and we're trying to be good examples. And we hope that you will too. We believe in our community. Our community has done so much, and we all love our children. And I know we can do this together. So please share the message. Please tell us how we can be of service to you and share the message. And we do look forward to communicating with you again. We will have another Fireside Chat next Friday, and we'll give you an update. And I would love to be able to say the numbers would be down, but it takes, you know, we're kind of looking at a lag time of a week or two to get them down. So I'd love to see a downward trend. and to inspire the greatest hope that we could for this holiday season. So,
And Sarah, that's why I put this calendar back up, because I don't want people to think like the ship is sunk. We're heading back to distance learning. We've been the county, the previous 3 metrics after our most recent 3, we were in the 30s compared to being in the 50s. So there's still plenty of time to get the numbers down. But we got to start kind of now. Like, I mean, now would be the time we're like, all right, let's start getting these numbers down. If we're gonna be below 45, 50 on this December 29th date. So it's still fully within our abilities to get those numbers down. So it's not over yet. We still got to fight, but I think we got to start fighting a little bit.
All right, I checked the other Facebook pages. I don't see any other questions, but of course, if they pop up, I'll do my best to respond to them over the weekend and, or email parents back. So.
all right,
That's gonna
friends,
hear from us
we'll
next
be in
Friday.
touch.
I like it.
Take care.